Hello, what's up? I'm Dr. Pepe Jimenez. You're on the Regenerative podcast with Dr. Pepe Jimenez, Director of Renovo Health and Beauty in the city of Tijuana. Today we are going to talk about a very important topic many of you probably hadn't heard. Let's talk about what precision medicine is. Sounds very interesting. Well, precision medicine started a project from the presidency of Barack Obama in 2015. He talks about how medicine was born, previously known as precision medicine.
Personalized.
It is very important to understand that when you go to the doctor, mostly in the United States, you go for an earache and the doctor will see to your ear. If you start to mention that you bring a problem in the abdomen, he will say, no. You talk to me about this, you came to the different, make another appointment because right now I'm not going to address the problem. Your doubt or your problem in the abdomen, then it has been seen that the patient does not feel heard, does not feel understood. It's a very medicine, quick, then a precision medicine speaks of that with this advent of the genome of detecting already with a lot of technology to be able to determine type of disease, type of cancer if you respond to such treatment. Treatment, we can give chemotherapy or not with the ability to see the genome, what precision, what disease do I have to treat. That's what precision medicine is about. So Barack Obama gathered his Congress people to doctors, engineers, to be able to create a system where now with a database we can give a much more personalized medicine or precision medicine. It is worth mentioning that now we have renewed technology with DNA in saliva. We can see that with precision already, knowing that we might be suffering from an undiagnosed disease. That's why some people realize they had cancer that could have been prevented thanks to this technology. Here, there's a lot of talk about the possibility of living forever, of achieving eternity, maybe in a few more years. Much more specific that precision medicine, being able to detect in such an easy saliva test the DNA that may cause illness, to suffer and take all measures to be able to change lifestyles and know that what people are taking. An example, much Coca-Cola, and you knew that you could have avoided having taken so much Coca-Cola for such a long time. Well, you would have avoided being diabetic, so we don't understand that until you see the problem much further down the line. You are enjoying the taste of a drink that you know is bad, but for the taste, the palate, well, it's like saying, well, I am addicted to the Oreo cookies. There are certain things, are not good, but it happened to me. Suddenly, the palate changes every time, and you say, now I am saltier. Sometimes I'm sweeter, but well, precision medicine, that means personalized medicine according to the pathology. To the gene, you are showing the disease. So now we can say that having this information with the genetic code, we can now give very specific treatments for certain pathologies. If I knew now at my 50, 60 years that if I'm going to look like a cancer, well, I would do everything possible to make these changes as it is a better food, do and exercise, not stress me so much, sleep better. Then, because that's where the genes come from, there are changes we need to make to avoid. So that's precision medicine. The medicine currently, Renovo Healthy and Beauty is encouraging to make not everything is going to be the same measure, the same treatment. If you go to an institution, I work in Social Security, and all patients are given treatment for hypertension disease. The same are done a diuretic. All the same, diabetic, I'm going to give everyone metformin, so we have to be doctors. We must personalize the treatment for each individual, not everyone. They are not going to respond the same because we are not robots. Each of us have a need, and depending on our genetic factors that can now be determined, we can give a much better treatment. So that's the futuristic modern medicine we're talking about. I believe that nobody was familiar with these kinds of terms. And now I also feel compelled to mention that I am currently doing a master's degree in Spain obviously online, where we still reinforce this kind of medication. Before getting into the subject, just by looking at knee pathology, we were given an introduction on how we need to look at a patient, a greater emphasis on medicine, and we are urged about the medicine of loss. Precision, why do I say this? Because before looking directly at a knee pathology, we must understand that we need to have a very good doctor-patient relationship, understand the patient's needs around him, and be able to treat the patient much better. If sick, then the more I know about the patient's needs, I will be able to provide a better response to a treatment, and the patient can have much more success. It's not feasible in 5 or 10 minutes to treat a patient without knowing all their history, and that's why, for some better reason. So, for precision medicine, that's what we need to provide quality treatment and see a patient, all their needs, to be able to reach a much more specific treatment. If there is any doubt, do not. You can contact us through our social networks, Facebook, Instagram, Instagram.com, on our internet at renovohealthandbeauty.com, where we will then give you the phone numbers so you can contact us and they can have a good experience. Consultation. Again, thank you for your attention. It was Regenerative with Dr. Pepe Jimenez. Until next time.